All right, let's get right into it. Today, we're talking about a major headline, one that could genuinely reshape medicine as we know it. A top AI company is officially stepping into the healthcare world with a whole new suite of tools. We're going to break down what this really means for doctors, for hospitals, and ultimately for you. And this, right here, is the heart of the story. We're not talking about some far off research paper or a maybe someday kind of promise. This is a real product launch. A new generation of powerful, secure AI tools is rolling out in hospitals right now. It's a huge moment where AI is making the leap from the lab straight to the bedside. So, what is this new platform exactly? It's called OpenAI for Healthcare, and its mission is pretty clear: help scale up high quality care, slash that mountain of administrative work that doctors hate, and power new custom solutions, all while, and this is the most important part, keeping patient health data completely protected. To really get why this is happening now, you first have to understand the problem. We need to diagnose the situation. And the reality is, our modern healthcare system is a system under some serious, serious pressure. And here are the symptoms of that pressure. First, patient demand is just constantly going up. Clinicians, doctors and nurses, are literally drowning in paperwork and administrative tasks, spending way more time with keyboards than with their actual patients. At the same time, medical knowledge is just exploding. It's expanding so fast that no single human being can possibly keep up with all of it. And to top it all off, because healthcare is so regulated, adopting new tech can move at a snail's pace. Now this number tells a huge part of the story. The use of AI tools by physicians has nearly doubled in just the past year. Think about that. It shows that doctors are so desperate for help that they're going out and finding their own tools, even if their hospitals can't yet provide them in a secure, official way. The demand is already there. Okay, so that's the diagnosis. The system is under strain. So what's the treatment plan? Well, it's a new digital toolkit, and it's designed to bridge that exact gap between what clinicians desperately need and what their hospitals can actually provide safely and securely. This solution really comes in two main forms. On one hand, you've got ChatGPT for healthcare. Think of it as a secure, ready-to-go workspace for doctors, researchers, and administrators. And then there's the API. That's the engine that lets developers build all these cool AI features directly into the software and systems that hospitals are already using every single day. So how does this actually work for a doctor in the clinic? Well, it's basically a three-step process. First, when you ask it a question, it grounds its answers in real evidence from millions of peer-reviewed studies, and it even gives you the citations. Second, it takes that evidence and aligns it with the hospital's own internal policies and procedures. And third, it helps automate those repetitive, time-consuming tasks, like drafting a discharge summary using an approved template. Of course, in healthcare, none of this works without rock-solid ironclad security. And they know it. The whole platform is built to be HIPAA compliant, which is the gold standard for patient data privacy in the US. It gives hospitals central control over who sees what. And most importantly, and I can't stress this enough, patient data stays with the hospital. It is never used to train the AI models. That is a hard, non-negotiable line. Okay, so we've seen what the platform does on the outside, but what's actually powering all of this? Let's pop the hood and put the AI model itself under the microscope. Right, so this isn't just a generic AI model they've repurposed. It's been specifically optimized for healthcare. This chart shows its performance on something called HealthBench. And this benchmark doesn't just measure whether the AI can spit back facts. It tests critical skills like clinical reasoning, safety, and communication. And as you can clearly see, this new model is a significant leap forward from anything that's come before. And this performance boost didn't just happen by itself. It was achieved through this massive human-in-the-loop effort. Get this. A global network of over 260 licensed practicing physicians reviewed more than 600,000 different outputs from the model. They gave it constant feedback to fine-tune it, to improve its safety, and to make sure it was actually helpful in real-world clinical situations. So the tech is powerful, it's been rigorously tested, but the real proof is in the pudding, right? Let's take a look at who is already putting this technology into practice, who's actually using it. And wow, the list of early adopters is basically a who's who of American medicine. We're seeing some of the most respected names in the game, from Boston Children's and Cedars-Sinai to massive systems like HCA Healthcare, already putting this platform to work. This makes it really clear. This is not some tiny pilot program. This is a serious, large-scale rollout at major institutions.
And we don't have to just guess at the impact. Listen to this from John Brownstein, the Chief Innovation Officer at Boston Children's Hospital. He talks about a path toward operational scale and responsible adoption. Now, that language, scale and responsibility, that is exactly what hospital leaders and IT departments have been waiting to hear. So all of this really points to a much larger trend. Let's zoom out for a second. What's the long-term prognosis here? Where does this all fit into the bigger picture of AI in medicine? You see, this big announcement is a key milestone, for sure, but it's really part of a much broader strategy. It builds on foundational research, on partnerships with life science giants like Moderna, and even on tools designed to empower patients directly. Today's launch of the Enterprise platform is the crucial piece that puts this powerful technology directly into the hands of the healthcare organizations themselves. So let's just quickly recap. We've got a healthcare system that's under incredible strain, with doctors and nurses actively looking for help. We've got a powerful new technology vetted by hundreds of physicians and built for enterprise-grade security. And we already have leading hospitals putting it to work. All of this really leads us to one profound question. Is this the breakthrough that healthcare has been waiting for?